So patients, very often, I see a lot of hand fractures, and I see fractures where people have hit an object, and definitely where they've hit another individual and struck him in a conflict. And so this is classically called a boxer's fracture. It can be a fracture that does occur in boxers, usually dealing with the little finger or the pinky. But the question comes after the fracture is healed. Normally there is some flattening of the knuckle, and patients want to know, is the contour or the bump of the knuckle going to come back on the back of my hand? And the general answer is no. And usually that means that there's a little malposition, or that bone after it was broken is out of place slightly. It doesn't take that much. And there's also some swelling that occurs over it. And if we're treating the fracture non-operatively, that means that it's lined up good enough for the finger to function well, but the finger can function well without the knuckle being there. So the fact that the knuckle is flat does not mean that there's anything wrong. It just means that there wasn't perfect positioning of the fracture and healing. That's actually a normal thing that I see after what's called a boxer's fracture, that the knuckle has an appearance of being much flatter.